Buckthorn bark contains anthracene derivatives, chrysophanoic acid, tannins, organic acid, essential oil. Buckthorn bark infusion has a laxative effect due to the presence of anthracene derivatives of glycosides, which cause irritation of the receptors of the large intestine mucosa. The laxative effect usually occurs 8 to 12 hours after taking the drug, used to treat chronic constipation. How to use? About 12 grams 2 tablespoons of the bark is placed in an enamel bowl, poured into 200 ml 1 glass of hot boiled water, covered with a lid, heated in a boiling water bath with frequent stirring for 30 minutes, cooled at room temperature for 10 minutes. Filter. The remaining raw materials is squeezed out. The volume of the resulting broth is adjusted with boiled water to 200 ml. Take orally 1/2 cup at night and in the morning. It is not recommended to take the drug for a long time without consulting a doctor. Contraindications. Increased individual sensitivity to the components of the drug, constipation of neurogenic and endocrine origin, spastic constipation, intestinal obstruction, bleeding, acute abdomen syndrome, appendicitis, other inflammatory processes in the abdominal cavity, acute febrile conditions, pregnancy, breastfeeding period. Side effects. Allergic reactions are possible. In case of an overdose, colicky abdominal pain, tenesmus, and a feeling of discomfort in the abdomen are possible. Long-term use leads to addiction and a weakening or lack of a laxative effect. Storage conditions. Store in a dry, dark place. Store the prepared infusion in a cool place for no more than 2 days. Keep out of reach of children.